Hey everybody, Dr. Julie McLaughlin and Dr. Jacob McNamara here today for day five, I'm not day 10, day 5 of our Painful Truth About Stress Challenge. So we are super excited to get started. And what are we going to be talking about today, Dr. Jake?
So today the theme is to feel good. So we're going to talk about feeling good and how to get rid of our pain, because pain is the number one thing that's stopping us from feeling great and doing our best and, kicking the day in the butt when we wake up in the morning. So we're going to talk a little bit about pain and things that you guys can do to reduce your pain. So I'm ready to get started.
All right, let's go. I got some slides for you here. Here we go. So, feel better. Feel better. That's what we want. So, stress and chronic pain cycle and how to break it, right? Because stress causes pain and pain causes stress. So, we want to break that cycle, right? And we got our little squeezy ball in there. And we have some brain ones here that we're using because, we want to fix the brain.
Yes. So, who has had pain in their life? I've had pain before. I've had injuries. I think that's a common thing that we all experience, and especially as we get older, our body changes and life takes a toll. So I think we all can relate to pain, especially back pain.
Yeah,
us being chiropractors.
Right.
This stat says it all. 80% of Americans will experience back pain that will last 2 weeks or more sometime in their life. This is just what's reported. We see this obviously every day as chiropractors, and this is a very big problem. That 20% that doesn't experience back pain, they're experiencing other pain. They're experiencing shoulder pain, knee pain, elbow pain, all that kind of stuff. And the great news is we can help those people too.
Yeah, absolutely. So what about sometimes do you feel like this? Just bang your head here, like if you had one of those days, right? So that's the stress, right? That's the stress. And 99.5% of Americans have experienced stress, especially this year, right? I don't think you're a living human being if you haven't experienced some kind of stress in your lifetime.
So fight or flight, that's our short-term stress. This is good stress. This is a normal physiological response. This is when we see that a bear chasing after us, our ancestors, and their sympathetic nervous system fires up, so their blood starts flowing to their muscles so they can run away. Or you flight and get scared, or you fight and then you attack whatever's attacking you.
That's right. That's right.
So prolonged stress and pain, we get stuck in fight or flight, and that's a problem because that's going to mess with that HPA axis that we talked about earlier this week, that hypothalamus pituitary adrenal gland axis. Because remember, our adrenal glands is what secrete the norepinephrine and epinephrine, which is responsible for that fight or flight response. And it also releases cortisol. So when this is constantly elevated, our cortisol levels just keep going up and up and up and up and up. And that's not good for our pain or our stress levels or our overall health.
Right, right. Because it affects our autonomic nervous system, right? So cortisol, that's that stress hormone. That's what gets our body ready for that fight or flight. But when it's present for too long, right? When that cortisol is present, that means the stress is present for a really long period of time, like day in, day out, day in, day out. That autonomic nervous system is part of our nervous system, which starts in our brain. We've been talking about a lot, and it goes down our entire spine, and it controls things like blood pressure and blood flow. And it's going to affect the body in a way that if you pulled a fuse in your fuse box, it would affect maybe the lights in your living room, or maybe, the lights in your bedroom, or your washing machine. When you get that switch flipped, it's going to affect you. And until you do something to change it, dramatically change it, it's going to continue, and you're going to turn into having chronic pain. And that's not what we want for you.
Yes. So we want to spiral up, guys. You can see our little spiral guy up there. He's ready to go. Cortisol is a potent anti-inflammatory hormone. It's good for acute stress, like we mentioned earlier, because it prevents that widespread tissue and nerve damage that's associated with inflammation. So it's good in a little bit, but too much of a good thing is never, it can turn into a bad thing. And when cortisol is released for long periods of time, like we've mentioned, it starts becoming a cause of inflammation and actually increases your stress levels and your pain response. So again, it's a good thing. There's a reason why we have it, but everything in moderation, and if it's too high for too often, we're going to have some issues, and then we're going to spiral down.
Right. Because think about our muscles, right? So in order to be ready for your action, your muscles will tighten and they'll overwork during chronic stress. And this causes prolonged pain. So it's really hard to imagine how stress impacts our physical body. So I always say, if you're driving in your car to work and someone pulls in front of you and you go, oh, right? And you step on the brake and you tense up. You don't all of a sudden go, oh no, I'm so relaxed. I'm ready for work, right? You still hold that tensed muscle. And then the phones are ringing and people want your attention. And you're doing all these things and you just hold it in your body, right? And some people hold their stress, they get headaches. Some people hold it in their neck. Some people hold it in their jaw and their backs or their fists, right? We all hold it in different places. Some people get stomach aches, but it's because we're holding that tenseness. So
sustained stress, prolonged pain. We mentioned before that cortisol, we got to tame it. There's a reason for it, but we got to control it. It's all about control and moderation and, living our best life.
Yeah, absolutely. And these are some of the warning signs that maybe some of that stress is impacting you and causing some of this pain. And we know that we can get injuries from other things, sports injuries, weekend warriors, things like that, falls and slips. But we also, the biggest thing we see is this chronic prolonged pain, neck pain, back pain, arm pain, excuse me, not COVID. Been talking way too much. Jaw pain, muscle spasms, grips, numbness, tingling, burning, mid-back pain, shoulder pain, even if you just can't, maybe you can't turn your head like you used to.
Speaking of turning your head, one of the biggest culprits of it is that forward head posture that we've developed from, all this technological advancement with, computers, cell phones, video games, all that kind of stuff. It causes what's called upper cross syndrome, where our shoulders start to round forward because we're typing or we're texting, playing a video game, and our head comes forward too. What's interesting about this is for every 1 inch of forward head translation posture, it can increase the weight of your head on your spine by 10 pounds each inch. Imagine that. So head posture can add up to 30 pounds of abnormal leverage in the cervical spine, and that can pull the entire spine out of alignment. Everything's connected from up here all the way down to our feet. And our spine is the main kinetic piece of the kinetic chain that holds it all together. So with that forward head posture, it can even lose the ability to breathe as well too, because we can't expand our lungs the way they should. And it's going to lead to neck pain, low back pain, even, hip pain. Your entire posture is going to be affected by this. So this is why in our office, we do a posture analysis and we provide exercises and adjustments and other therapies that's going to improve individuals' posture so they don't get these kind of symptoms.
Yeah, absolutely. I always say, if you have a bowling ball, let's say you had a 12-pound bowling ball, about how much an average person's head weighs, you could hold it like this all day, right? Where you're relying on the arm bone, or are you going to hold it out here where you're relying on your muscles? You couldn't hold that bowling ball very long if you're holding it out away from you as opposed to here. But yet we're all holding our heads out here. So we need to change that, right? We need to be really conscious of that, because neck pain, right, is from poor posture, among other things. But you get a reduced blood flow, reduced oxygen to your brain. Like, nobody wants that, right? Your memory's not going to be so good. You're not going to be making good decisions if you're reducing oxygen to your brain. And so if you're coming down like this and your lungs are 30% decreased, how do you think you're going to get oxygen to everywhere you need, right? And it adds more stress to your joints. It slows your reaction time. And of course, it causes pain.
Yes.
And nobody has time for that, right? Nobody has time for that pain.
So here's an example of the posture screen that we actually do in our office. And you can see the difference in, from the left to the right, the before and after, which it was, that was only what, 3 months after about?
Yeah.
Yeah, about 3 months. And you can see these changes can happen. They can happen relatively quickly. If we really approach it, the right way and get you guys on the right track with the right exercises. That's why we do this whole analysis. We do functional movement screenings, and we help you guys move better. So we're not moving dysfunctionally, so we can get out in the world, we can exercise, we can, kick the day's butt like we want to.
Absolutely. I mean, I think not only is his posture better, but I think he looks like, way younger as
Oh,
well.
absolutely. Yeah.
So, who doesn't want that little fountain of youth?
Mhm.
So,
How do we break the cycle?
yeah, how do we break that cycle?
One small change at a time.
That's right.
Again, guys, that's the mantra this week. That's one of them.
Yep. And we want to think better. We want to have that elimination diet. Remove that anger, regret, worry, resentment, guilt, and blame, right? Because that's going to help us de-stress, and that's going to help us get rid of some of our pain.
Let's replace avoidance with action. We got to stop avoiding our pain, because that's just going to cause us to spiral down. We got to figure out our choices. We got to make a decision and take action so we can spiral up.
Yeah, absolutely. And then you want to find the cause of the stress and pain. You don't need to cover up the symptoms, right? So I always say, if you have a headache and you take an aspirin, you didn't have an aspirin deficiency that caused your headache. I can guarantee it, right? So find out what's causing it and treat the cause, then you eliminate the problem.
I like that. That's a good one. That's really funny. So what's the best way to find the cause? The best way is to visit a professional that knows what they're doing. This is why we are chiropractors, and we perform chiropractic care on patients, because we're educated in this, and we learn how to do examinations, diagnose, and then treat what the pain generator is. We're not treating symptoms here. We find out what's causing the problem. We try to fix it, okay? Because everything that's coming, it all starts in our brain. We've been talking about it all week. That information travels down our spinal cords, it exits our nerves to our extremities, and every cell in our body. It's is innervated, and it's gonna and certain dysfunctions we have are gonna affect every certain cell in our body. That dysfunction, we can't breathe as well when we have that forward head posture. So we work on fixing that. We correct subluxations that can possibly cause nerve impingement or segmental dysfunction, and we find the root of the cause, and we fix it and get you guys feeling better.
Yeah, absolutely. And, one thing that you want to look for when you do go and talk to a doctor, if you come to us or if you come to somebody, you want somebody who's going to examine you. You want somebody who's putting their hands on you to do different testing to figure out what's wrong. You don't want to go in where you just talk to them that, oh, okay, here you go. Here's a pill. Here, go get this test done. Go get this thing done. Get somebody who's actually checking you to find out the cause, right? Don't just take it for granted. Well, my symptom means this. There's lots of things that you can do: orthopedic tests, neurologic tests, movement, posture. Make sure that when you're getting this done, if you're not getting it done here, that's what you're looking for, right? So in joint pains, we've been talking a lot about the spine, but we can get pain in our joints as well. So where's that fire? That inflammation is like fire in those places. And if you've experienced this, it feels like fire, right? So we want to try to eliminate that inflammation and that joint pain, but what's causing it? Where's it coming from?
That's how you put out the fire. We're not dampening the fire. We want to put it out.
Right. Absolutely. So what this shows is we have nerves that come out our entire spine. So we have 7 vertebrae in our neck, 12 in our mid back, 5 in our lower back. And each side, we have nerves coming out, and they go to different things, right? So they go to our intestines, they go to our arms, they go to our legs, they go to our thyroid, they go to our brain. And so sometimes you can get symptoms that are maybe not pain symptoms, but maybe you're getting constipation, right? Well, maybe that nerve that's going to those intestines aren't working properly, and it's coming out of your spine. And a lot of people say, I didn't tell you I was constipated, but I got adjusted and I'm going to the bathroom much better. So it's an interesting chart. We have it here in our office if you'd like a copy of it as well. Oops.
So what do we do when you're in pain? A great place to start is chiropractic care, because we're going to get our hands on you. If your shoulder's hurt, we're going to feel that shoulder. We're going to perform tests on it, and we're going to figure out what's causing the pain in that shoulder. If you have back pain, we're going to do the same thing. We're getting our hands on our patients so we can find the issue. And if we need more imaging, more testing, we can do that too, which is great. We usually start with some sort of movement therapy, such as rehab and exercises, depending on how acute a patient is, but we get them moving correctly and functionally. We include anti-inflammatory diet. We also include supplements that can reduce that fire in our bodies, all that inflammation we're feeling in our joints. We also have massage in our office, which is great for muscles and soft tissues. We have acupuncture, which is great for a multitude of different ailments. And we want your last resort to be medication, going to a pain clinic to get pain pills, or avoid any type of steroid injection, surgery, or anything invasive. We like to approach things conservatively to keep your body in as healthy a place as it can be.
Absolutely. And go for good enough, right? Go for good enough. You just have to start. And so one of the things that you can do to become the best version of yourself is fake it until you become it, right? So I want you to just write down in your little notebook that you guys have been keeping, how can you make yourself proud today? What's your one thing that you're going to do to make a difference, to feel better, right? I want you to do all 5 of the things that eat better, think better, sleep better, move better, and feel better. But by writing it down, fake it until you make it.
The best part about that is when you start doing these things, your future self is going to thank you. Trust me. So.
Yeah, absolutely. And as we always say, we are here for you because our sole focus in practice is to improve the quality of life and health for every person we encounter. And that's why we've been doing this challenge all week for you guys, because we want to make sure that we continue to educate you on things that you can do to improve your health, but we're always here as your doctor and we're always here as your coach. So you want to set goals, make decisions, and take action.
So who wants to learn more? Anybody?
So yeah, we have a master class that's coming up that we want to tell you about, that you're really going to be able to have a little bit of a deeper dive into the overall.
So when is the master class? You're wondering, I'm sure. It's Thursday, March 4th, 12:30. So be ready, guys. It's next week on Thursday at 12:30. We're going to be there. We're going to explain more information. We're going to talk more about the neurology, more about the physiology behind stress and pain, and we're going to get you guys feeling better and educate you on what you can do yourself to improve your lives and spiral up.
Yeah, absolutely. So either register in the Facebook group, we'll have the registration link in there, or we'll send it out via email so you guys can register, because we're going to do this one live and you guys can, ask questions at the end, and it'll be really fun. So that's it for our 5-day challenge. That was day 5. And we look forward to seeing all of you at the masterclass.
Yes, congratulations, guys. You did a great job doing this challenge. Thank you for participating. Again, leave any type of comments on your stories about spiraling up, and let's get this community together so we can spiral up together and lift each other up.
That's awesome. All right. Bye-bye.
Thank you.